My treatment will be on intervention for epicondylosis. My name is Jeff. Here we have the objectives, purpose, statistics, supporting research, future research and conclusion, and we're going to have a video demonstration and practice. So my exercise is the Tyler twist. The purpose of the Tyler twist is to perform an eccentric exercise, and you can do it to strengthen the flexor or extensor muscles that attach to the epicondyle of the elbow, depending on how you perform the exercise. So the technique is you're going to hold a towel forward and you're slowly going to extend the wrist. As you can see in the photo, you're going to eccentrically perform the motion, slowly releasing the towel or the bar, and you're going to do 3 sets of 15 repetitions according to the research. Here's a photo. The study Tyler et al. In 2014 looked at the reverse Tyler twist for treatment of medial epicondylitis. There was an average of about 12 visits over 6 weeks. These patients had epicondylosis, which means they had symptoms over 6 weeks, and they needed to have palpation tenderness on the medial epicondyle, pain on resisted wrist flexion, and pain on the medial side of the forearm. The statistics they used were paired t-tests, and they looked at the DASH outcome measure. Since it is not a test, there was no sensitivity and specificity that they were looking at. As you can see, the scores improved quite dramatically. Some limitations to this study was that it was only the first study looking at this eccentric training for medial epicondylosis. There's a lack of prevalence, so medial epicondylosis isn't as common as certain injuries. And the effectiveness of this Tyler twist could not be directly attributed to their success in treatment because they did have other physical therapy treatments involved. Tyler et al. In 2010 also did a study beforehand on lateral epicondylosis, and they had a similar idea where they did the Tyler twist, and they looked at this one with a control group and the Tyler twist group. So they did a randomized control trial. Once again, they had over 6 weeks of pain, and they had 3 criteria again as well. And the difference with this one is the tenderness was on the lateral epicondyle, it was with wrist extension, and they had pain doing middle finger extension. So here we have some of the statistics. They looked at the DASH outcome measure, they looked at the visual analog scale, and they also looked at strength and tenderness. As you can see, there were improvements with the Tyler twist group compared to the standard treatment group. Future research, obviously they need more research. There's not a lot of data out there right now, and they need more randomized controlled trials. The sample sizes were also relatively small, and the power was not as good as it could have been if there was a larger sample size. But overall, the Tyler twist is worth using in the clinic if a patient has had duration of their pain longer than 6 weeks and fits that criteria of their tenderness that they used in the study. I think it's a simple exercise and it doesn't require a lot, so it's good to use. Here are the references and the studies. And here's a video demonstration. As you can see, you can perform this exercise both eccentrically for the flexors or the extensors, just depending on how you move your hand. We'll now go through a demo of this in class.